Fox 5 Health News, we're talking about mental health. Since 2013, there have been 74 suicides and hundreds of interventions at the George Washington Bridge. Now, the Port Authority is installing a temporary fence there in an effort to save lives and to keep people from jumping.
Joining us now is Dr. Devichechi to talk to us about suicide awareness and prevention. Good to see you, doctor.
It's good to see you, too.
It seems like we talk more and more about it these days. It's very, very upsetting.
Well, the number seems to be going up,
yeah.
You know. I mean, there are different factors that are involved. We usually think about depression as the primary cause, right. But there are several stages where we can intervene, right? So if someone is showing signs of depression, so this could be sleeping a lot, thoughts of hopelessness, helplessness, even mood swings or other changes, that's one place where we can intervene. But then also if you look at sort of this progression, getting towards the fence that they're building at the George Washington Bridge, typically a person might be depressed, but then they move to maybe these thoughts of suicide, right? Or passive thoughts where you think, oh, I wonder if the world would be better if I wasn't here, but sort of passive thoughts. And then people progress from there to more active thoughts where they kind of try to come up with a plan. So if we can intervene at any of those stages, that would be great. But in that last part, that's where this wall is going to make a difference, right? Where there's a moment of despair, maybe a moment of impulsivity, and then someone decides that they're going to jump. But what you see a lot of times, at least in the statistics, is if you can even intervene then, so to get the person away from this plan, or to stop them at that moment, then maybe even if you don't necessarily treat all the other symptoms right away of depression, that maybe they can just rethink it right at that moment, and that would make a difference. That would save that person's life.
No, I saw a crazy documentary about the Golden Gate Bridge and people who jump off it, and they recorded it. And one guy who survived, he said, the second I jumped, I regretted it.
Yeah.
You know, and you got to get them before they get to that point. It's terrible.
I think especially, if you know somebody that may be thinking about this, or if you're thinking about it, good to call the National Suicide Prevention Hotline, even calling 911. I mean, on this bridge, or in general, if you see somebody who's in a dangerous situation or you think there might be a possibility, better to intervene than to leave the person kind of in this situation. And here, especially with the George Washington Bridge, they say the average is that once every 3.5 days, someone is attempting suicide. Now, our police officers have done a great job at preventing it, at stopping the people, maybe getting them away from the bridge. But right now, there's no physical barrier. It's just a waist-high sort of railing. So
and then they wind up putting their own lives in danger. So a physical barrier could also protect police as well.
Them. And unintentional injuries, right? We're talking about suicide, but even if somebody falls or something else happens, at least if it's there, it'll protect them, save lives that way, too.
Right, okay. Let's talk about this. U.S. researchers are getting ready to recruit more than 1 million people for an unprecedented study. They say the goal is to end cookie-cutter health care. This could be really promising.
I think this is really exciting, So there are so many things. I mean, in general in medicine, we use these guidelines and we apply them to everyone. They're based pretty much on research, either animal research, or if you have human research, it's sort of general demographics, right? Like, the person is this age, maybe this gender, this ethnicity. You have very little information about the person and maybe something about their condition, and then you decide this is the appropriate treatment path for them to follow, right? The idea behind this type of what's called precision medicine or personalized medicine is that you're actually collecting their genetic maps. So you actually have a sense of what are they genetically as a human being, and then what lifestyle factors and environmental things make a difference. So, I have a lot of people, for example, patients who are smokers who say, maybe why should they stop smoking? Because even though most people get cancer, have, various health problems related to smoking, they haven't, right? So, why is it that these things make a difference in one person versus another? Or diet. Why do 2 people eat the same thing and one person, gains a lot of weight and another one doesn't? So it might be related to genetics. So in order to tell the difference, you need a large number of people. So that's 1 million people that are going to be genetically mapped, and then take a look at all these different factors that might affect them. And ironically, I was going to say, we think about things from the surface like what you see, right? So we describe people maybe according to hair color, eye color, skin color, all these different things. But genetically, people may be very different. So, for example, you'll see on Facebook or some other things where it's like, oh, I'm actually Native American, or this percentage, something else. So with the genes, it could be very different than what you look like on the outside.
Totally,
Absolutely. Recessive genes, there are all kinds of things that play a part into it. And the study's going to last for at least 10 years, so it should be rather
so it'll take some
comprehensive.
time. Yeah, so these things will take a long time because a lot of these genetic factors interacting with the environment, you don't necessarily see the effect immediately. It takes some time for conditions to develop.
It's going to make the way we have been doing things, I think, seem very archaic.
Yes, it should be more tailored.
Targeted and tailored, indeed.
Absolutely.
All right, Dr. Devichechi, we appreciate it. Thank you very much.